Medicare supplement that we are introducing in June of this year. If everything goes well, our expected release date is June the 16th. So right now everything's on track. Some of the states are approved. Some of the state departments are kind of slow. So as we move through this today, if you have questions, go ahead and text those in to Rashawn. She's on the other end, and she will kind of answer those as we move through, and then we will read those back at the end of the webinar. So what we want to talk about today is the name of the product. It's going to be called the Senior Savers Association Medicare Supplement. As with any association, there will be a membership fee. We'll show you how this product will compare to the rest of the market on some competitive analysis data that we have attained. And of course, with any product that we offer on a MedSup chassis, we will have the telephonic application available to you, as we did with our other product back in 2010 when we introduced it. So a little bit about why we introduced it. As you well know, if you guys have been in the MedSup market today, and in today's environment, you can only have one Medicare supplement on the market. In other words, we can't have a Heartland National Medicare supplement with one set of rates and then just introduce another Heartland National Medicare supplement with a different set of rates unless you do it on a group chassis or an association type venue. So that's kind of what we've done, is we've got together with the Senior Savers Association, been putting this thing together for a little over a year, and that way we can have a regular Medicare supplement and then an association Medicare supplement also. And that way we can kind of introduce a fresh set of rates and remain competitive. Okay, so this will be what the front of the brochure looks like. Introducing, it won't have introducing on it, just have the Senior Savers Association on the front of it, and that is their logo that you see right there in front of you. So to kind of make it simple, guys, a lot of you have been in this business for quite a while. If you remember, Continental Life had a group trust Medicare supplement, something similar to this. But if you think in today's marketplace, who else has an association type product? Have you ever knocked on somebody's door, and once you sit down and go through your discovery with them, and you ask them who their current Medicare supplement insurance is with, and they say AARP? Well, you and I both know AARP does not sell insurance. AARP is the association that they belong to and have membership dues that they pay into. United Healthcare is the insurance company. Same concept. Senior Savers is the association that will have membership benefits, and Heartland National Life will be the Medicare supplement. So that's kind of an apple-to-apple type comparison to give you an idea of how this will work when you're in the sales field. Okay, so there's things that you and I need to know when we're out there selling this product. First off, there's an application membership that they have to fill out. Just like with the AARP, when you go into their Medicare supplement, there's a little box. I believe it's either in the upper left-hand corner or right-hand corner, and it is where you take the information from the applicant, and that's their name, their address, their phone number, things like that, and a signature spot, which again, you will do this in the home if you're doing a paper application. If you're doing a phone application, you'll still want to fill this out for your records, but then we will verify that through the telephonic app process. And this will be right at the very beginning of your app pack. So you're going to fill that out with each application for the association. Again, it's in the very first part of it. The dues are $2 per month. So if you have someone that's paying by the year, it'll be $24. If it's every 6 months, it's $12. If it's a quarterly premium, which we hope you stay away from quarterly and semi-annual as much as possible, but it would be 2 times 3, that would be $6, and most of the business that we will get, we know, is going to be on a monthly bank draft, and that will be verified and voice signatured on the application process, $2 per month. Okay, talking points. You and I got to have some background of the association to let them know, what am I getting for my $2 each month that I'm paying. If you need these pages, we can email all this stuff to you. I would encourage you to get this so that you'll be a little familiar with these types of things when the client or prospect asks you, well, why am I paying $2 a month? So that you can kind of go through some of this stuff with them and let them know that the association was developed in Illinois in July of 1987. Their principal address is in Missouri, Chesterfield, Missouri to be exact. And the Senior Savers Association's motto is to promote health of seniors by providing its members information and education on senior-related issues and developing and distributing benefits, privileges, and services to the members. They do have an annual meeting of which that member will be notified of. They can either attend or send in their vote for board of directors, whatever they're voting on, by a proxy. And the association will provide benefits of interest to its members and periodically mail newsletters to those members to educate them on a variety of different products. One of the next pages you'll see in this application app pack is right here. It is a summary of benefits, and if it were me, and here's the ones I will highlight, I probably would not spend time going through all this, but I definitely would go through a couple of these. On the health services side that I have highlighted, there's a 24-hour nurse help hotline. If a person, let's say they get diagnosed with diabetes and they're confused and they're really not remembering exactly everything that they found out at the doctor's office, because trust me, I know this for a fact, there's a lot of information when you get diagnosed as being diabetic. They can pick up the 24-hour nurse helpline and ask questions 24 hours a day, 365 days a year. Another thing that I know a little bit about is hearing aids. As you guys can tell, I'm getting up there in age. Getting old's not always cracked up to be. So Association Hearing Aid Services, they have a mail order service that can provide 50 to 60% discount on quality hearing aids. Guys, I'm wearing a set of Phonak hearing aids, paid about $5,400 for them. Even if I saved 10%, let alone 50 or 60, if I could just saved 10% on an identical type of product, that's $500–600. If they only pay $3,000, that's still $300. That pays a lot of $2 a month membership. So there's good benefits right there in this membership kit. And stop and think about how many seniors you'll talk to in the course of a year's time, that when you walk in, how many of them actually are wearing hearing aids. I mean, it's just, I started doing this back in 1984, and the hearing aids that they had back in those days were not near as good a quality as what the people can buy today. Another thing, if you look down toward the bottom, how many times have you went into a senior's house and there was tables and tables of magazines? You virtually can get a good benefit on popular titles, gift subscriptions. A lot of seniors will get a magazine subscription to their grandchildren or to their children for Christmas. Things like that, they can definitely get value out of this. There's a discount on long distance through Sprint. A lot of seniors in today's world carry cell phones. It amazes me how many seniors have even got rid of their home phone and went strictly with nothing but a cell phone. So there's definitely value for the $2 they're paying. And the more you and I know about it, the easier it is to overcome the reason they're paying $2 a month for that benefit, on top of being able to buy a very competitive Medicare supplement through the association. So enough about the association. Talk a little bit about the Heartland National product now. As you can see, the states in yellow are currently approved. So Arizona, Wyoming, Nebraska, Missouri, Illinois, Tennessee, Alabama, South Carolina are up and ready to go on the 17th of June. Hopefully, I just sent an email or a piece of paper back into the Texas Department of Insurance. Hopefully that will satisfy all their requirements, and we'll have Texas on board here shortly. Kansas may be a while, and hopefully Indiana, Georgia, and Texas are the three I really want to see come online. They are still pending, and as you see at the bottom, all states will offer a 7% household discount, with the exception of Missouri, which will be 12%. Now, let me explain to you what discount is, or what that household discount means. A household discount means only one person need to apply. In all the states that we file this product, there's none of this. Two people have to apply and be approved. So as an example, if you have a 65-year-old man turning 65 in July, but his wife won't be 65 for 2 or 3 more years, since he's in open enrollment, you know he's going to be approved, he's going to qualify for a 7% household discount. Guys, that's huge to you and I when we're out there selling. All states are 7 except for Missouri, it's 12, and the household discount means 2 people must be living in the household. They do not have to be married. It can be 2 brothers, a brother and a sister, a man and his partner, a woman and her partner, or a husband and wife. There is a minimum age requirement. The youngest person in the household, the second person in the household, does need to be a minimum of 30 years old. It can't be a grandparent taking care of his teenage son-in-law, or maybe they're living with them while they're going to college and they're 21, 22 years. That does not count. The other person in the household has to be at least 30 years old. And after 30 years of doing this Medicare supplement business, I can't think of too many situations I was ever in to where somebody that's on Medicare is taking care of someone below age 30. I mean, that's just not something you're going to run into every day. We think that about 3/4 of the people that you talk to will qualify for the 7% discount, or in Missouri 12. That's just a great, great benefit when you're marketing a product. It could be a situation to where maybe one person's on kidney dialysis, the other person's in perfect health, and in this situation, even though you got a dialysis patient in the house that will not qualify, you have another person in the house, you got 2 people in there, you can still give the second person the 7% discount. Okay, any questions on the discount, go ahead and send those in. We'll answer those at the end of the webinar. We'll read those back. Let's take a look at the rates in the states that are approved, and we'll also look at the ones that are pending. I'll kind of go through this kind of quick. I think you can see that we're going to be very competitive in the states in which we're in. These are all based on a 65-year-old female. If you look at the bottom, rates are based on a Plan F, female, age 65, non-smoker, in the lowest area factor, and our rate also includes a 7% discount. Again, only one person need to apply in order to receive that discount. So in Alabama, if you are in a situation where you can offer a discount, that female is going to come in at $111.75. The release date, the approval date was in March, but the release date is June the 16th. So keep that in mind as we go through here and you look at the effective dates. The release date is what you need to adhere to, and that is June the 16th. In Arizona, another good state, right now we're coming in almost $10 a month cheaper than CSI or Equitable or Combined, on about 13 when you look at those. American Continentals that were $14 less. And as you can see, all of those are fairly current release dates. Again, our release date will be June the 15th. We're at 116.27 against the competition at 125. Great, great position to be in Arizona. Illinois, again, very strong rates in Illinois. We think we're going to get a lot of good business out of the state of Illinois. We're $10 cheaper than Combine. Combine's a very strong product up there. Mutual of Omaha, we're about $13 a month less. So we've got you guys a really, really good product in Illinois that you can hopefully put down some good business. Missouri, 140.85. We're still about $1.50 higher than Stonebridge. Stonebridge's effective date was June the 17th, 1 year ago. Coming up on their 1-year anniversary, I'd look for that rate to tick upwards somewhere in July or August. If you're listening from Missouri, you know what Stonebridge is doing, and now the question is how big will the rate increase be? I've got a couple different theories. I think with Transamerica, they're going to do everything they can to hold that rate as competitive as they possibly can, but year 2 is what really concerns me, or year 3 is when they'll have their big rate increases. My theory, I don't know that, I'm just going on what I've seen in the past years, different companies. But we're at 140.85, and again, that release date in Missouri with 12% discount, effective June the 16th. Now, guys, one thing you're going to get from me is straightforward, so I'm going to tell you something. If you're selling in Missouri, then you're not going to like what I'm going to tell you. With Missouri's anniversary rule, companies like Stonebridge, Mutual of Omaha, any company that you want to think of outside of one that I know of, they'll come in, they'll have a strong rate in Missouri. 3 years later, they won't have hardly any of that business left on the books because with the guarantee issue rule, they're not able to underwrite, and they get all the The bad business, if you look at Missouri's rates, we're 30 to 35, 40% higher than any state that touches us on a turning 65-year-old female. So there's only one way to really control that. And the way the other company does it is they pay $25 on guarantee issue business in Missouri on the Missouri anniversary rule, and they include the Missouri anniversary rule in their language. This is the track we're going to go down. In June of 2010, when we introduced our Medicare supplement in Missouri, we wrote close to $7-8 million of that business in this state. There's hardly nothing of it left. Why? Because we've had a couple of rate increases. As you guys well know, companies take rate increases and sometimes large increases in Missouri in the 17 to 30% range sometimes, and then that business gets moved somewhere else. So we'd rather write less and hold it, and for that we have made some changes in your contracting. We're going to pay you a lot longer than the 6-year average. Of course, the way things are going in Missouri, you'd be darn lucky if you get somebody to stay on the books for 6 years. But we think we're taking an approach to where we can help you not have to go out and sell the same dirt over and over every 2 years in this state. So in Missouri, I know it's not what you want to hear, $25 on guarantee issue, including the Missouri anniversary rule, and that's unfortunately the way we have to move forward. I'm just like you. I sell insurance in this state. I live in Blue Springs, Missouri. I've got a load of business in this state, and I have to adhere to those same rules also. So on one hat, I'm angry. On the other hat, it's the only thing we can do to get a block of business in this state and hold it. So if you have any questions, give us a call. We'll go over it with you. And you may not want to write the product. That's fine. We know there's going to be a lot of agents that say, you know, I'm not going to do that. And that's okay. But as a company, we have to protect the company. We have regulators looking over our shoulders, so as all companies do. So that's the way it is in this state, unfortunately. Nebraska, a product that we feel very good about. We are looking at $95.11. Again, that will be available to you in June. Manhattan Life, they should be coming up on their 1-year anniversary. Equitable just recently had a rate increase, put them at $102.50. They're still competitive and still a very good company. They also have the telephonic app and onboarding process. Add that to these two companies, Heartland and Equitable, and you're still in a very, very competitive position. South Carolina, a state we did really, really good in and still have a good block of business in. We think this is going to really help our agents out in South Carolina continue to write business for us. We're looking at 101.05, and as you well know, that's a very, very strong rate in South Carolina. We think probably combined, according to what we're hearing, might possibly have a rate increase. They may not have one for a while, so they're still in a good shape also. Equitable still not very far down the line there. They're at 110.67. Again, both of those companies, Heartland and Equitable, offer you that telephonic onboarding process for your clientele. Guys, there is some changes we're going to make in the telephonic app later this year, and trust me, they're going to be for the better, and it's already pretty darn good. So we'll get that out to you as soon as we get a little further down the road. Tennessee, another good product, another good state for us. We're coming in at 107.57. Again, don't forget the rates I'm showing you on Heartland paper includes a 7% discount. And again, we think that you will be able to apply that discount in 60 to 70% of the households that you run into. So you're gonna want to take a look at our product in a lot of different areas. Wyoming's not a very big state, but if you look at that rate, that's pretty strong. And for a turning 65 female, $99.86 a month. We know that not a lot of business comes out of Wyoming. Even if you had every senior in the whole state insured, you wouldn't have that big a block of business, unlike a state like, just like Missouri or some of your better states like North Carolina, California, Florida, and those areas. Just not that many people out there in Wyoming, but for those that are, we have a pretty darn good product and offering for them. Okay, from here forward, we've got about 5 states we want to look at that we have proposed rates in these 5 states. I don't know when they will be approved, but when we come in, we will be in Colorado about 123.48. That's pretty in line with a lot of other products out there. So, it'll be people that want to use our telephonic app process, and once that happens, once they get used to that, it does make us a little bit more competitive than some of the other products because of the process in which we have, and we'll cover that here in just a minute for a refresher and get to that shortly. Georgia, we're at 11984. Georgia was an extremely good state back when we introduced our modernized plan in 2010. As you can see, we're in a pretty strong area if we get those rates approved. Now that's another thing, you know, they may come back and make us adjust those, but that's what the state's looking at to approve right now. So hopefully we will have them on board here shortly. Indiana, another state in which we want to get this rate out there. If you can look at that, you'll see why. 105.81, that's about $9 a month less than Combined or CSI, and even better than that than Medco. So we think once we get this rate approved in Indiana, the business will come in very, very good in that state also. Kansas, who knows when they'll approve it. Kansas is one of the toughest DOIs out there. I'm not saying that's a good or bad. I'm just saying they're hard to get stuff shoved through. They may not approve that rate at all. They may not approve the association filing. They do have some stringent rules in Kansas, but if we can get that rate approved, guys, that's a very, very strong rate in Kansas, 111.67. The big state we're really waiting on, another country you might say, Texas got their own economy down there, so we know that if we can get this rate approved, and hopefully that will happen shortly, we're going to have an extremely good offering for you folks in Texas. Turning 65, female, age non-smoker, and lowest area factor, we're coming in at 110.88 with the discount. So hopefully by this time next week, Texas will have said, okay, you've satisfied all our requirements, it's good to go. But until then, that's just a proposed rate, and we're kind of, as the old saying goes, stuck in the mud. Okay. Let's take a look at the application. It is different than some of the standard applications that you will see. Not a whole lot of difference, but there's different things that you have to be aware of, just like with the association filing that we looked at earlier. There is going to be a premium calculation page in the beginning of the app where you start filling it out, so that if you have any questions, what's the discount here, how does it work, then you can come back right here, put your premium in here, and figure it accordingly. So the first step is the enrollee's age and their zip code. Based on those two factors, you'll find the premium in the outline of coverage. In this example, we got $150 up there. If they qualify for the household discount, and I'm using the Missouri application here, and again, these are not actual numbers in any state. This is just a graph for you to run on. And here you would take 150 times 0.88. That would come up with 132. That is your monthly bank draft premium. You do not have to put down quarterly, semi-annual, or annual as this does. This just gives you those variables. If they're paying it that way, is how you would go about figuring it for each calculation on each mode. Okay, once you get through that, then you're going to come to the Senior Savers Association application. The Senior Savers Association will automatically be filled in your name up there, so that when that app comes to us via paper, if you're doing a paper app, we will know it's a group policy. When you identify yourself on the telephonic app, it should be Jose, this is Bill Ellsworth with Heartland National Life. My agent number is 140570. I'm sitting here with Miss Jones. She is applying for the Senior Savers Association Medicare supplement. You need to identify that because there is a other Medicare supplement available out there also. However, it has had rate increases. We're not getting a lot of calls or business on that, but just remember to identify this as the Senior Savers Association Medicare supplement. In Part 1, it's strictly the personal information. You guys are all familiar with that. I'm not going to bore you to death with going through each line. Part 2 is the plan selection. Very important that you understand that we have A, Plan F, Plan G, and Plan N, as in Nancy, available for you to sell. And guys, if you think our Plan F rates are pretty good, take a look at G and N. For those people who are considering that, you're going to be in very, very good shape. Part 3 is the eligibility information on Medicare, or when do they become eligible for Medicare. If they're turning 65 in a couple of months, you guys know how to fill that out. You would answer that no and put the eligibility date as 8/1/14. So that's the Part 3 of the application. Part 4 will be the determination on where they stand in their current insurance situation. If they have any, they may not have any, and then your answers would all be no. Are they applying during a guarantee issue period? If yes, you got to have that proof of that eligibility. Then you come down to number 3, and that's going to ask questions about their current insurance. Do they have a Medicare Advantage plan? If they don't, you check no. Move on to 4. Do they have a Medicare supplement? If they don't, you move down to 5, and maybe they're coming off of a group plan, they're turning 65, then you would fill out number 5. But generally 3, 4, or 5, in most situations, you're going to check yes on one of those, no on the other. Very simple, standard application that's in every company's application, so you guys are familiar with all of this stuff. Part 5, very important that you go over Part 5 with your enrollee, especially if you are doing a telephonic app process, for the simple reason we're going to ask you, did you go over the general information located on page 3 of the application? And that's where they do not need more than one Medicare supplement policy. They may want to evaluate their current information or their current coverages. And then 3, 4, 5, and 6 all deal with Medicaid should they become eligible for those types of insurances during the ownership of this policy. And again, that's in all other applications also. Just make sure when we ask you or your client that they've at least seen this and you've went over it with them, and the correct answer should always be yes. Guaranteed issue eligibility is Part 6 of the app. Then you're going to move right on into Part 7, and this is going to ask you on the application and remind you about the discount. Does at least 1 but no more than 3 adults reside with you in the home? The answer is yes. The reason we have no more than 3, and this came up on a webinar just the other day, and somebody asked a question about, well, what about assisted living facilities? So they're asking me, okay, only 1 person's in this apartment, but there's like 50 people in this assisted living facility. No, that's not a qualification for the discount. It has to be 2 people in the apartment, not in the facility. So this will jog you for your discount. To remind them, we're going to need the name, social security number to verify that there actually is somebody in there, so that nobody's trying to pull the wool over anybody's eyes. Part 8 is our premium information, and your initial premium, a place for your dues. If they're paying monthly, you'll put plus $2. There is a one-time policy fee of $25, total amount submitted. Right to the right of that, don't forget to request your effective date, select a bank draft date, and by all means, if they're paying bank draft, make sure that you check the I authorize bank draft payments. Now, we'll do all this for you if you're doing a telephonic app. We'll verify all this, but you need to have verified the premium, the dues, and how much the premium will be. So we'll verify that, we'll record it and log it, and everything's in the back of your application at the end of the application. We're going to cover this more in detail here in just a second. Make sure you check the draft initial amount. Maybe they don't want to give you any money right then. Maybe that's in the middle of the month when you're there with them and they've had a lot of expenses. They want to apply for your product. They love the price, but they don't want you to draft until the policy's been approved. So you send it in, or you do a telephonic app, and then the underwriter will establish with them on the phone when is a good time to draft. Usually the underwriter's questions will go something like this once they have went through the medical information and your app is approved. They'll say, now, Ms. Jones, your premium's going to be $150 a month. Now, we're going to draft that within the next couple of days. Is that okay? If she says that's fine, we'll draft the next couple of days. But if she says, well, you know, I've had a lot of expenses, could you wait and not draft me until, say, around the 3rd day of June? We will establish that. We do not want to cause any overdrafts or anything like that. But that's a slick process with a telephonic app. Guys, It's a mistake-free process. You're going to love it if you've never done it. If you've never done it, you should get used to it because it does have some very big advantages that we'll talk about here shortly. Okay, health questions, pretty straightforward, pretty serious conditions on there, but if you drop down to note to applicant and just go to the very third line, it says if you answer yes to any of the following questions, 1 through 14, you are not eligible for coverage. So if you come down to question number 3 and you're sitting there and they say, well, I have been diagnosed with Parkinson's disease. Usually you'll be able to see that because they'll have tremors, but maybe not. Maybe they just got developed and they don't have any tremors, but they answer that yes. At that point, guys, it's a no-go. You got to move on to something else. You're not going to be able to put that piece of business through. But maybe you come down to question number 6 and it says, if you have diabetes, we're not saying we won't issue them, but if they have diabetes, do they have any of the following conditions? Diabetic retinopathy, peripheral vascular disease, neuropathy, or any heart condition including high blood pressure, or kidney disease. If you do not have diabetes, this question should be answered no. The next question is, do you have diabetes that's ever required more than 50 units of insulin? If they say, I'm taking 35 in the morning and 35 in the evening, that's 70 units of insulin. Can't send it in. So if you run into those situations, you may want to be contracted with Equitable because they will rate them a little bit more, but they will take diabetics over 50 units of insulin. We won't. That's not in our underwriting criteria. So any question answered yes on here is a knockout. Place for their medications, and very important, when the telephonic process comes for your client, I always have my client get their medication bottles out. Now, I fill this out for them. That way they can read right off of it. So let's say they're taking the medication name, you write down amlodipine and the date it was originally prescribed. I take amlodipine. If you ask me when I started taking it, I couldn't start to tell you. I know I've taken it for about 4 years. So what I would write on there is when it says date originally prescribed, this is 2014, I'd put down 2010 approximately. That's going to satisfy the underwriter. That way she'll know that they've been taking it long enough to know that you're getting stable readings and your blood pressure should be okay. What we're really looking for is if I said that I'm taking amlodipine and I started taking it May the 1st of this year, well, that means there's no criteria out there for the underwriter to say, is that going to fix my blood pressure issue or not? So make sure that if they can't remember the original date, and most of them won't, that you get an approximation of when they started taking it. Dosage and frequency, are they taking 5 milligrams, 10 milligrams, 1 time a day, 2 times a day, and what the diagnosis is for. If a person tells you they're taking Aricept and they don't have a clue what it's for, well, there's a good reason. That's for Alzheimer's disease and they can't remember it. So make sure they're aware of those 4 issues because the underwriter will verify that on the applications. Very, very simple. But the better you and I are prepared, the better the underwriting interview will go. At the bottom, it says primary care doctor's information. Dr. Joe Jones, put his phone number down there. So when we ask that, the patient can read it right off there. I mean, I know my doctor's name, but I couldn't start to tell you what his phone number is. So make sure you have all that stuff readily available, and that will help your underwriting process and the telephonic app process go very smooth. Back when we came out with our 2010 offering and we had the telephonic app, we had agents writing in about how well they loved it. Guys, I'm here to tell you, once you get used to this telephonic app, you'll wonder why you haven't done it in the past. Part 11 is our signature page where they sign, you sign, put your name or the name and agent number on there. The very bottom of that is your supplement. Did you meet with the enrollee in person? If you did it over the phone, you'd answer that no. So just very simple questions, fill them out. You won't have any issues at all. Let me go back there. Notice that on the very bottom it says producer number 1. Please print your name and your producer number. If you're splitting, we also need the second agent's name and producer number also. Got to have that at time of application. We can't go back and do that 2 weeks later. This is your HIPAA privacy notice. As you well know, if we're doing a telephonic app, we have to do a HIPAA verification that they're aware of HIPAA. We will not read this whole thing to them, thank God. We have it narrowed down to about 6 lines, been approved by all the departments of insurance, and it's a very, very quick statement that we read to them, and they acknowledge that, and we voice record it. If you're doing a replacement, you guys are familiar with replacement notices. They got to be filled out, and this is one thing about the process coming later in the year that we're going to show you a way to get out of having to have this wet signature on a replacement notice. Okay, so that is the process, the application, and now let's talk about the Express app and why I think you guys really, really want to use this. About 4 or 5 years ago, I can't remember how long it's been. It may be longer than that. I got a phone call from Linda Janitis, and she wanted to know if I'd be a guinea pig for a new process that they wanted to do called an Express app. I told Linda I'd try about anything once. I wasn't the smartest person in the world, so sure, let's get it going. So we got the Express app up and running, and guys, it has gotten so much better since that time. Some of you on this phone I know have used it, and some of you have not. So for you who have not, this is a very, very good process for our sales force, and we get a lot of good feedback. So there's 2 different ways of doing an Express app. You can do it at a kitchen table, which is what I grew up with, or you can do it as a remote setting, which a lot of agents that are having call centers in today's marketplace absolutely love this process. It speeds up what they do tenfold. Okay, so I get asked a lot, isn't this the same thing as a drug screen? And no, it is not the same thing as a drug screen. It's not the same thing as an e-app. With a drug screen, you're doing a pre-qualification call. And with an e-app, you're filling out an e-app and you're submitting it to the insurance company, and it still has to go into their workflow. And if it's a fully underwritten app, they still got to underwrite it, and that may be a week from now, it may be 2 weeks from now. If there's any problems, it may be in queue for a while. So we're going to show you a way to where by the time you get done, with your telephonic app, that the application gets completed in full over the telephone, and you will have a policy number and an effective date when that is over at the end of a 15 to 20-minute phone call. So the application is completed in full. It's stapled to the back of the policy. It's included in every application or every policy once it goes out. But here's one of the things that I love about this. After selling MedSup for 30 years, I'm here to tell you I've made a lot of mistakes on applications. I forget to fill out something. You get a letter from the company saying you got to go back and get a signature, or you got to fill out a new app, or you got to do this, you got to do that. That will not happen with this telephonic sales process. It's a mistake-free process on the agent's part. The only paper we're requiring is the replacement form, or if you're listening from Illinois, you guys are aware of the Illinois checklist. You're one of the only states out there that have that, so if you're in Illinois, you do have to have that filled out also. The application, we have simplified underwriting. We're looking at about a 96% issue rate. I put this on there, 15 minutes process, start to finish, but I do want to clarify something. That's if you're doing an open enrollment situation or a guarantee issue situation, because that eliminates the health underwriting and the verification of medications. So that eliminates quite a bit of time on the process. I always tell agents, if you're doing a fully underwritten app, you can expect 20 to 25 minutes, depending on whether the person's taking no medication, maybe he's taking 1 medication, maybe he's taking 5, nothing bad, but 4 or 5 different medications. So all of those add time, but the company-wide average is about 23 minutes. So I can't just give you an exact time, but if you're doing open enrollment or guarantee issue, very quick process, about 15 minutes. This is going to be about as close to an instant issue Medicare supplement policy as you're going to ever get. Now, If you did a telephonic app right now and you just now got it approved, wouldn't that tell you as an agent that, hey, I'm going to get paid pretty quick also? Once that policy drafts and that premium clears their bank, you're going to get paid almost immediately after that. I tell guys, give us about 5 days turnaround time, and don't include Saturday and Sunday in there because we're closed on Saturday or Sunday. So it allows us, we pay commissions 5 days a week, Monday through Friday. So once you're clear, we'll get you paid extremely quick. So that's another good thing about this. I still get excited when I go out and sell a policy, and I know I'm going to get paid in the next couple of days. So very, very important that you understand that by using this Express app process, it does help us put money in your account a lot quicker. Okay, so I've got 3 things right here that I want to talk about real quick. Immediate results, better and quicker for your client, and gives you more flexibility. So what do I mean by that? Well, immediate results means there's no guessing or whether you're going to be issued or declined. You know at the end of the telephonic app, your policy's approved. No guessing. You don't have to make a trip back if you get declined 2 or 3, like I just today. Well, not today, I'm sorry. Yesterday I got a call from Stonebridge here in Missouri. I wrote a policy on Stonebridge, and it was on a guy that was taking quite a bit of medication. I wrote it 2 weeks ago and found out yesterday he got declined. So what does that do for me as an agent? I got to get him back on the phone and say, hey, Don, good news, you got declined. However, I got a couple of other opportunities I want to take a look at. I can come and see you next week, but I'll pick out a couple of times when I'm talking to him, and hopefully he's going to say, okay, well, go ahead and come back and see me. Or it could go like this. I don't know. I haven't called him yet. That's what I'm going to do when I get off this phone call. It could go something like this. Well, Bill, I'll tell you what, probably not going to get approved in any other carrier. I'll just stay where I'm at. So if that happens, I've lost a commission that I thought I was going to earn. I knew I couldn't write him on this product because it wasn't available yet. I knew I couldn't write him on Equitable because I knew he wouldn't qualify based on one medication he was taking, but I thought I had a shot with somebody else. So I may or I may not get back in the house. But my point being to you and to you on the phone or on the webinar is, wouldn't it have been a lot better for me as an agent if I would have known that the day I was sitting face-to-face with him, if he wasn't going to qualify for my product? I could have said, okay, let's look at AARP. That's what I would have probably done right off the bat. Or I can wait in Missouri. As you guys know, if you're from Missouri, I can wait till the guarantee issue period, which is about 4 more months from now. But the bad thing is he's going to have to keep paying that higher premium. So if you're going to get a decline and you're not in a guarantee issue state like Missouri, you can immediately go to another product. You don't have to make another trip back to the home. It's a lot easier to go from policy A to policy B if you're sitting there face-to-face with him. You've already built rapport with him. You don't have to worry about a conversation that could go south on you, like, you know what, Bill, I'll probably get declined from somebody else. I'll just stay where I'm at. I'm going to go ahead and just pay my other premium. So if you're going to get a decline, get it immediately and deal with changing horses in the middle of the stream right then and there. Okay, another thing that it gives you a lot of flexibility with, this is what, the 29th day of the month, if I remember right. Let me look here. Yeah, this is May the 29th. We got, what, a couple of days left in this month. Let's say you're sitting there talking to a prospect and they have disclosed to you in your discovery period with them that they've got XYZ company, and they just found out last week or two that they're going to get a rate increase effective June the 1st, and it's going to go up another $40 per person. So they're looking at having to pay another $80 out of their pocket for their Medicare supplement premium. You sat there and talked to them and you showed them our product, and all of a sudden you realize that your premium that you're quoting them is a few dollars less than what they're currently paying, and a whole lot less than the $80 that's going to be tacked onto what they're going to be paying in June. And they say to you, you know, I'd like to have your product, but I know I'm going to have to go ahead and pay this premium another month at least, maybe 2, before I find out whether you're going to approve me. And you have the ability to say to your prospect right now, well, Miss Jones, I'll tell you what, we do things a little different here at Heartland. Let's pick up the telephone, talk to the underwriting department right now, and let's see if we can get you approved. And if we can, then we can solve that problem, because I'll know at the end of this phone call whether you're approved or not. Is that fair enough? They say yes, you get them on the phone, you do your thing, they get the client on the phone, they do the telephonic interview, and the next thing you know is everything is good to go, and you generate a commission, and you save them quite a bit of money. So it's a great, great process for that time of the year or time of the month when they're facing a rate increase. Another good thing, as I mentioned earlier, is call centers are loving this product and process. They can actually sell it over the phone. That's a huge benefit for them. That gives them huge returns on their phone or on their time, just like it does you. You don't have to go back and worry about selling the same dirt that you thought you sold a couple weeks prior. And again, as I mentioned earlier, it does let us get money in your account quicker. I never had an agent complain about getting paid fast. It also is a great way to defend an existing block of business here. If you're working with a carrier that's having one of those large rate increases of 20–25%, you can sure reach out and touch a lot of people over the telephone and save a lot of money if you don't have to drive and see each one of them and have the ability to enroll them over the telephone. Okay, so talk a little bit about the two different platforms. I'm not going to spend a whole lot of time talking about the remote selling simply because there's not a whole lot of difference, and time restraints makes it a little hard to do that. So in the kitchen table process, the first thing you do is you sell that product in the home. You're going to pick up the telephone. You're going to call our underwriting hotline. That telephone number is 866-916-8818. That will take you to our underwriting department directly. They're going to ask you to complete the agent process. The things that are involved in the agent process are right here. They're going to make sure that you are appointed with our company and licensed in the state in which you're calling from. They'll get your applicant's name, your effective dates, the bank draft dates, all the general information that they can get from you. Where do you want that policy sent to, you or the client, the city and state that you're taking that application in, and of course the name of the carrier if you're replacing. And remember, I told you they would ask you this question right here. Did you read to the applicant the information on Part 5 of page 3 of the application? And as you remember, the correct answer is yes. Okay, so once they do that and they get all that done, they're going to say, okay, Bill, put your client on the telephone. Now, guys, once that client comes on the phone, remember the application, Part 1, the personal information, Part 2 is a plan selection, and so forth, all the way through the app. They're going to go clear through the entire application. They can't go to plan selection unless every required field of the Part 1 has been logged. Again, no mistakes. So they're going to go through the complete application with your policyholder, neatly type it. It'll be typed in the application that comes out with the policy. Now, it won't be exactly in this order, so let me just give you a little bit of a heads up. When you're sitting there listening to the telephone interview, and they'll do Part 7 before they do Part 6. They'll verify the medical information and the drug information before they go to Part 6. So if you're sitting there face-to-face with your prospect and they're on the phone and they have went through the health questions, and you'll hear the conversation going back and forth. You may not hear the underwriter, but you'll hear your client respond to them, and then you'll hear your client give the prescription history information. We'll do a Milliman script check to make sure that they're giving us all their medications, and then they will ask the premium information. But if they ask the medical questions and the prescription history, and then they say, well, okay, go ahead and hand the phone back to your agent, you know at that point you're going to get a decline. If they don't discuss premium, as the old saying goes, time to do something different, because that's going to be a decline. I've had that happen one time in the last 4 years, but I'm pretty darn thorough when I go through the health information and the prescription history information. So do a good job on that. You shouldn't have an issue getting your policies issued. Okay, at that point, they're going to say, okay, Bill or Mr. Jones, hand the phone back to your agent. Now, guys, if you haven't listened to a whole lot of what I've been saying, what I'm about to tell you is by far the most important part of the telephonic app process. When that phone comes back to me, the agent, here's what I do every time, and I would encourage you to do the same thing. I hit the speaker button on my telephone. If their phone that I'm calling, if I call from their home and I'm using a toll-free call where it doesn't cost them any money, I check their phone for speakerphone capability. I ask them, I say, do you have a speakerphone on your telephone? If they say no, then I'm going to not use their phone. I'm going to use my iPhone because I do have speakerphone. I want the client to hear what's going to transpire between me and the underwriter at this time. So if that phone comes back to you and they have verified premium information, you know you're going to get a policy approved. So I'm going to hit the speaker button and I'm going to say I've got Adriana on the phone. And she says, okay, Bill, your policy's okay. Do you want the policy number? Why do I want my client to hear that? Of course I'm going to say yes. So she says, your policy number is 2896344, and I write that down. If I'm replacing a policy, I'm going to write it right on the replacement notice because I'm going to have to send that in. Okay, so I write that down, and she says, your policy's approved on June the 1st. It's going to go into effect June the 1st. The premium's going to be $150 a month, and we're going to draft that on the 5th day of each month. I want my policyholder to hear that because when I leave the house, I don't want those two words that you and I both hate to come back and bite me in the backside, and that's called buyer's remorse. When I leave, my policyholder doesn't have to worry about, I'll bet I don't get approved, I'm taking this medication. They just heard the underwriter say the policy is approved. So once the underwriter reads that all back to me, at that point, I say, okay, now, Adriana, I wrote all this down. Let me get this right. My policy number is 2896344, right? That's correct. Mr. Jones is going to have an effective date of June the 1st of this year. No waiting period. He'll be covered as of June the 1st. That's correct. The bank draft's going to be $150 on the 5th of the month, right? That's correct. Okay, Adriana, that's all I need. I appreciate you. Take care. I'll talk to you soon. The underwriter hangs up. I verify all this again with my client. I said, hey, that worked out pretty good. You got approved. You're going to have a June the 1st effective date. Now, Mr. Jones, let's do one other thing. Get your ID card that you currently have with XYZ Company. Let's call them and tell them not to draft your bank account in June. Let's get you off of their draft schedule. We don't want you to have to pay 2 premiums in 1 month. So at that point, I pick up the phone, I call XYZ Company, tell them what's going on, identify myself as an insurance agent, and I'm here with Mr. Jones, and he's going to want to cancel his policy effective June the 1st. Now, they're going to ask Mr. Jones to get on the phone and verify all of his information, his name, date of birth. You guys know how, if you've ever done that, you know how that story goes, because they can't just take your word for it unless he gives them authorization to talk to you, which I want him to do. So now what has happened? I have got him a better policy, a better price. I've took care of canceling his other policy, so when I leave that house, I don't have to worry about Mr. Jones saying, well, I wonder if I'm going to get approved. Maybe I should have stayed where I'm at. You guys know how buyer's remorse goes. Anytime you buy a big-ticket item or an important item, you're questioning, am I doing the right thing? Well, your client does the same thing, and everything that we can do as agents to eliminate buyer's remorse from them is kudos for us and a benefit to them. So I encourage you to do that, to put it on speakerphone. You can't do the whole interview on speakerphone. They'll tell you to take it off because they'll get feedback. But just for that brief period of time, hit the speaker button. Let your client know I am approved. Okay, so the phone comes back to you, the agent. You do that. You get the policy issued, the sale's complete, and we move on to our next opportunity. Now, I'm going to buzz right through this because I'm running out of time here, and I want to get the questions in and out of here. So the process for the remote sale, basically the same thing as a kitchen table sale. The only difference, you're doing a 3-way telephone call. You stay on the phone the entire call. You do have to be quiet. You cannot coach during any of the HIPAA-protected information, you can help with their name, their address, some of the current information if they're having a hard time with it or they don't understand it, you can help verify that. But when it comes to health questions and drug information, you got to make sure they can do that themselves. And again, very, very important that we have that policy sold before we call the underwriting department. They're not going to sell the policy for us. That's our job. Okay. Created what we call a cheat sheet, and basically, guys, it's not a cheat sheet to hide anything from us as a company. It's a cheat sheet to help the interview process go smoother. Basically, you can look at these things, and if the underwriter says, well, Miss Jones, do you have what is your Medicare number? And she says, I'll have to go get it out of my checkbook or out of my billfold, and that slows us down. Same thing if we ask her for her banking information. She says, well, I'll have to go get that. Or if we ask her about her medications, well, that's in the medicine cabinet, I'll be back. Make sure they have this stuff readily available. If you want all this stuff, we can email it to you. Just let us know. We'd be happy to get it into your hands. Again, the important statements, make sure they know that to answer yes when we ask that question. Again, telephone number for the replacement form, you can fax that into 800-506-8295. Most importantly, do not coach that applicant. Let them answer their questions on the HIPAA-protected information, and you shouldn't have any problems. Again, if you want all this, we can email it to you. This will come out in every application or every policy that's sold on an association chassis. As a Senior Savers Association member, you can enjoy many benefits including the 24-hour nurse helpline, emergency travel assistance, and so much more. And then there's a box with the login information, and there's a toll-free number should they have any questions. So all of that will go out with the policy once it's delivered. All of that information will go from the TPA to the association, and a packet goes out, and we will make sure that they handle those calls so that you're not getting calls on the association. Our underwriting hours, guys, we're open 12 hours Monday through Thursday in every time zone, 11 hours on Friday. Again, that number is 866-916-8818. There is our information as far as our company. You have our Coronado address. That's our corporate address here in Blue Springs. That's where I'm at. Our corporate office, again, is in Salt Lake City, Utah. And we do have an extremely good back office support team out there in Salt Lake. Contact information for us here, you can get a hold of me at bill.e@e-hfg.com. Todd Weiss is our regional sales director. Dolly handles our licensing. Grishon is our marketing guru. She's on the other end, going to read back some questions here shortly. If you need supplies, you can order those all off our heartlandagent.com website. Very, very good website for our agents to go to and navigate. So anyway, Grishon, I'm going to get you on here, get the questions read back, and then we will let these guys get back to work.
All right, Bill. One of the first questions I have is they want to know, does the rates that we have include the $2 fee for the association product?
No, the rates that you've seen on the screen were insurance product only. You would add $2 to each one of those for the association.
Okay. And they want to know, when they do the telephone interview, can the underwriter add the $2 to the monthly premium so the clients don't have to pay it separately?
Correct. We will do that. We are doing that, going to do that, yes. It'll be one draft come out of their account.
Okay. And the other question they had is, if they are diabetic, is that an automatic decline?
Well, we go back to the question. If they're diabetic and on pills or controlled by diet, that's not an automatic decline, no. If they're on medication other than insulin and they have complications such as neuropathy, that is a decline. That's why I was saying if you have a diabetic that is on more than 50 units of insulin, you'd want to look at Equitable's application. That's kind of like a sister company that we use, and they will maybe consider that where we wouldn't. still there?
Yeah, I thought you had cut out. I was like, what went on? The next question I have is they want to know if you can explain the why do rate increases vary so much between different insurance carriers, and what do we use to determine the rate increase?
Well, that's a really, really good question, and I think I can add a little light to it. First off, insurance companies they've got a mandated loss ratio of 65% for Medicare supplement. In other words, what that means, guys, unless they're paying 65 cents of every dollar back in claims, so if we get a dollar, 65 cents has to go out the door to pay claims, then we can't ask for a rate increase. But if we have a situation that maybe our claims loss is 110% for a year, we're going to have a rate increase because that's way above 65%. A lot of that is, let me just be frank, in two different areas. Luck of the draw. You may have a block of business that's extremely healthy for 2 years, and then all of a sudden, bang, maybe 80% of them go to the hospital the next year. I'm just making up numbers. Everything that has to do with claims loss determines premium. Another thing that really, really kills premium is when you have guys out there submitting bad business. You've got a person that's maybe in a guarantee issue situation, and you say, okay, you're on kidney dialysis. Let's see, that's a pretty good deal for the insurance company. You're going to pay $150 a month, and they're going to pay out $4,000 to $5,000 every month for the rest of your life. Things like that affect rates. A lot of states have guarantee issue laws to where insurance companies cannot underwrite. And if you get and Missouri's one of them, that's why we're taking our stance, okay, you send me all that guaranteed issue business in the state of Missouri that you want, but I'm not going to pay you but $25. So what do you think the agent's going to do? He's going to send that somewhere else. That's the only way we can control that, is to do that. Maybe the State Department comes back and says, you can't do that 2 or 3 years down the road, but right now that is allowed, and we will do that. So, guys, think of a three-legged stool. Think of you getting paid, the insured getting a good product, and the insurance company being able to operate at a profit. We have to be able to make money to stay in business. So if you're sending me nothing but bad health, how do you expect me to stay in business or to keep my rate stable so that you don't have to go back and replace it? And again, it may not be your fault. We look at different things. You can have agents out there that are writing good business, and all of a sudden you get a shock claim. Well, that's not your fault. That's not our fault. That's just life. Those things happen. But I terminated 3 agents in Louisiana the other day. Matter of fact, letters are going out here today. For the simple reason, I look at things like this, and these 3 agents that I terminated had all written 8 to 10 policies in the last year, and every one of them was Medicare disability. I would be dollars ahead sending them money each month and say, hey, don't send me any more business. I'll just send you a commission check. But that kills my rates in a state when you find it. That's why I look at that stuff every week. That's one of the first things I come in is I start pulling up production reports, and I look at behaviors that agents are doing. And if I don't mind a Medicare disability claim or a piece of business as long as you're giving me a mix of good business. But when you select me out and just give me nothing but that, we're going to have a parting of ways. So those things all affect rates. And guys, I'm an agent just like you are. You got to spread that stuff around. You can't just select one company out and give it to them. You got to give them good business along. If you're going to give them the bad, you've got to make sure you're giving them a good sample of good business also. So that's kind of my perspective from both an agent and a company person also.
Okay. Another question I have, can you please explain the process of sending in the replacement notice if you're doing an over-the-phone telephonic app?
Good question. Yes. I always have, a lot of agents don't want to pay the postage, but I always have the policy sent to me, because if I have that policy sent to me and I have to have a replacement notice signed, that replacement notice will be stapled to an orange envelope. I believe it's either orange or yellow. It's stapled on both corners of that envelope. So when I get that policy, it reminds me to say, Mr. Jones, I got your policy back. I'm going to need you to sign the replacement form. I've already signed it and dated it. You just need to sign it, take it loose from the envelope, and mail it back to the company. It's in a yellow envelope, and it's already self-addressed. You don't need to worry about it. That's the way I do it. Now, if you want us to send that policy directly to your insured, what a lot of our guys are doing is they know they're going to have the replacement notice sent. In today's world, a lot of seniors have computers, and they can scan it and email it to them. Or if not, as soon as that policy is sold and approved, they've got the policy number. They write that policy number on that replacement notice. They put it in an envelope and then ask the client to sign it and then mail it back to the company. But you can do it either way you choose.
Okay. I have someone who has some questions regarding the medical question, the automatic decline for the diabetic. And this is how their question reads, is if they answer yes to any of the medical questions, it says it is an automatic decline. So the question is, are you diabetic? And they have to answer yes. They said that you referred to it as saying they will still yet get approved. So can you explain that, please?
Let me pull the question out, and I'll just read it back here.
Okay.
Give me just a second, folks, to get the application pulled back up here. I'm getting there. Okay, so there's two questions about diabetes. Question number 6, if you have diabetes, do you have any of the following conditions? Diabetic retinopathy, peripheral vascular disease, neuropathy, any heart condition including high blood pressure or kidney disease. If you do not have diabetes, this question should be answered no. So you're sitting there talking to a diabetic, and he said, yeah, I'm diabetic, but I do not have any retinopathy, vascular disease. I take good care of myself. He can answer that question no, just like the question says. If you have diabetes, we know, okay, we established you got it. Now do you have any of the complications that go along with diabetes? That's what we're looking for, okay? If they have diabetes and they're on more than 50 units of insulin, you know they can't issue that. If they're on, say they've got diabetes and they're taking 10 units of insulin in the morning and 20 at night, well, that's 30. So then you go back to the other question, do they have any of the retinopathies or neuropathies? Neuropathies where they get the tingling in the feet or the numbs, they get the numbness in their hands, things like that. In other words, there's internal organ damage caused from the diabetes. So it's kind of a tricky question, but the underwriter will be very good at establishing it. And the question's self-explanatory. If they got diabetes and they got other problems, that's going to be a question they have to answer yes. But if they got diabetes and it's well maintained and they don't have any of those problems, at that point they will have to answer it yes. So, or they can answer no if they don't have any of the problems. Now, one of the things that the underwriter will do, we have made exceptions. So if you got a diabetic and they are in height and weight's good, they're non-smoker, they're on metformin and also taking one blood pressure medicine, I would give that a shot. There's a lot of times we can look back through the Milliman script check and see that that diabetic has been well controlled. They've been on the same medication for 3 or 4 years. They'll probably go ahead and give you a pass on that. So you just got to ask yourself when you're sitting there and you're talking to a diabetic and they're 5'2" and 250 pounds, is that someone that you would trade $150 a month premium and pay all their medical bills for? Common sense will tell you probably not. So, diabetes is a tricky disease. It really is. I've had it for not quite a year right now, so I'm just now learning to take care of myself. I'm not overweight. I don't smoke. Nobody in my family's ever had diabetes. Can't say that now. I've got it. So I'm taking metformin. Outside of that, I'm in pretty good health. So hopefully that'll help. If you have any questions, guys, email me at bille@e-hfg.com. Give me your phone number, and I'll give you a call, and we'll go over it in more in detail.
And that was actually our last question, Bill.
Okay. Hey, folks, I appreciate you. Take a look at this product. We're going to have it available to you on the website here to where you can get supplies ordered here real quick. And we are going to roll that out in the states that we looked at on June the 16th. Again, anything I can do to help you, or if you have questions, email me or give me a call at 800-373-4000, and I will get back with you. Take care. Appreciate every one of you. Have a great day. Bye.